Tonight on Reporting Scotland. The Conservatives attacked the Scottish Government over the number of coronavirus infections that were acquired in our hospitals. Good evening. The Health Secretary, Jeane Freeman, has told Parliament that 894 NHS staff are either confirmed or suspected to have coronavirus. That's in addition to hundreds of patients who have developed the disease while in hospital. The Minister said it was not yet possible to be sure how many of these infections had actually been contracted inside the NHS. The Conservatives have renewed calls for her resignation. Here's our Chief Political Correspondent, Glenn Campbell.
No one goes to hospital to get sick, but hospital-acquired infections are a feature of modern healthcare, and at Holyrood, Conservatives raised concerns that COVID-19 is one of the diseases patients are picking up inside the NHS.
People have entered hospital without coronavirus, they've caught it there, and they have died, Cabinet Secretary, when testing hasn't been able to be provided.
What we know is that during this pandemic, a total of 901 patients have developed confirmed or suspected coronavirus symptoms while in NHS care for another reason. Of those, 218 patients have died. But ministers say the figures are estimates.
Cabinet Secretary.
And attack the Tories for treating them as established facts.
These are suspected transmissions, suspected cases, suspected deaths linked to them. Although all of that is clear, you have chosen to take unvalidated data and pretend that it is validated. That is inexcusable.
Her mother was in
But other opposition MSPs are worried about the potential scale of hospital-acquired coronavirus too.
Families do deserve answers, they do deserve an apology, and they absolutely need an independent inquiry to get to the bottom of this, and most importantly so that we can have confidence that as we restart our NHS, people, patients and staff will be safe.
A concern shared by Liberal Democrat leader Willie Rennie.
But I have to say this whole episode has shaken my confidence in what the government is telling us.
Alison, Johnstone to be followed by
The Greens think more widespread coronavirus testing in hospitals would help.
But while we ask questions in this chamber, potential asymptomatic carriers are walking around hospitals with the potential to infect patients and high-risk staff.
Ministers accept there may need to be more testing in hospitals, more mask wearing, more cleaning. They're waiting for fresh expert advice, just as they're waiting for the final data that will confirm how many people have actually picked up coronavirus in hospital and how many patients brought it in with them whilst not showing symptoms. Glenn Campbell, Reporting Scotland, Holyrood.